Hello, my name is Dr. Chris Ellis. I am a physical therapist, and I put this presentation together for some students at Florida Gulf Coast University, my alma mater. So this is a pre-recording before I actually deliver the presentation to them so they don't have to take notes. I first became interested in breath and the science behind it and breath work in general several years ago at a Wim Hof seminar. I went to the seminar having no idea what I was getting myself into. The instructor was Yuri Opendik, amazing guy, and it blew my mind. It was my first time doing breath work and my first time doing a cold plunge, and it honestly changed my life. At these Wim Hof seminars, the cold plunge is kind of the star, and I think a lot of people show up for that. But to me, the breath work is way more potent and powerful. Every time I do breath work, I seem to get deeper into it, and it just elicits a crazy response. So today I want to get into some of the science behind it, why I like it so much, and as a physical therapist, how we can use this clinically. But first, just a little more about me, because I think it will help kind of tie this presentation together. So I've been an outpatient physical therapist for, at this time of this recording, over 11 years. Last year I got certified in functional medicine, and I own a cash-based physical therapy practice. So what that all really spells out is that when you start off as a physical therapist, you can be very siloed in your work, mostly because insurance dictates that. And as I've moved into a cash-based setting, I became more holistic in my approach, treating the whole body and not just a single joint. Functional medicine kind of does the same thing. Well, it definitely does the same thing. It's all about getting to the root cause. The timing of all this is kind of interesting because the breath work kind of pulled everything together for me, because it's really how we take energy and convert it in our bodies and how we affect our nervous system. And as you'll see, this can have some pretty profound effects on the body. All right, so let's dig into it. So I'm going to start off with a few quotes. This is an old Chinese adage. What the bodily form depends on is breath, and what breath relies upon is form. Now, I like this because it shows sort of the cyclic manner in which breath and the body kind of work together. And it's a two-way street. So you can watch how someone's breathing and tell what state they're in. And then you can also reverse engineer and change the state they're in by changing the breathing mechanics. Here's another one from a famous physical therapist, Gray Cook. If you can't control your breath, you can't control your movement. I love this one. And I saw Kelly Starrett I think he maybe changed it a little bit, which he says, if you can't breathe in a certain position, you don't own that position. So, and I see this all the time. You see an older gentleman with a big belly, he wants to get off the couch or off a chair, and he tries to stand up, and he holds his breath, and face turns bright red. That's a sign that he does not own the ability to get out of a chair comfortably. Or maybe you're a CrossFitter, you're doing a pistol squat, and it's hard for you to do, and you're holding your breath doing it. It's okay. You don't own that position truly until you're able to breathe with it. And I think this holds true for not just body position, but athletic performance in general. So the Olympics just passed, and I was a big fan of watching Sha'Carri Richardson run. And all the elite runners, if you watch them, they are sprinting top-notch, unbelievably, with their mouth closed. Breathing through the nose. They own that. So some things we'll go over in this presentation. We're talking about some breathing fundamentals, some of the physiology, what happens to our blood gases, the Bohr effect, which is really interesting, and also the effects of temperature on blood gases. Then we'll go into some assessment. We'll look at breathing mechanics, talk about mouth versus nose. We'll talk about the Bolt test, and a topic that sort of overlaps, which is HRV, heart rate variability. Then we'll discuss 4 different types of breath. Just so you know, there are tons of different ways to breathe. I just picked 4 that I thought were relevant and that can be accessible to anybody and something you could use clinically. And then we'll get into some of the implications as a physical therapist, how breath can affect your lymph, how it can affect your back pain, some special topics like sleep apnea and physiologic flexibility. And before we dive into this more, I want to do a quick quiz. So this is, again, meant to be a quiz for my physical therapy students. So I'll just, for the sake of this presentation, I'll ask the question, give a small pause so you can think about it, and then I'll give the answer. So the autonomic nervous system is comprised of what 2 systems? You've got the sympathetic system and the parasympathetic. The sympathetic is fight or flight. Parasympathetic is relax and digest, or some call it the feed and breed state. I'm going to focus a little more on sympathetic for this little quiz here. So what are some of the main hormones that are, or chemicals released by the body when you're in a sympathetic state? Okay, so you've got epinephrine, norepinephrine, and cortisol. Cortisol is what's known as the stress hormone. It kind of has a bad rep, but it's a good thing our body produces cortisol. It is a necessary chemical when in a fight or flight state. The problem is a lot of us live in a fight or flight state and we're not truly in one. So when cortisol is pumping through the body, what does that do? It releases sugar or glucose into the bloodstream. And why is that? Well, we have two main sources of energy. There's more than that, but the two main ones our body likes to utilize are their fats and glucose. And glucose is more readily available. So when you need quick energy, the body secretes cortisol, which turns into sugar release, which becomes quick energy for fight or flight. Now, as I mentioned earlier, a lot of us live in a sympathetic state all the time because work, because finances, because taxes, because who knows what. And what that does is keep cortisol pumping through our body. And if you have sugar being released constantly, what hormone is released to counteract that sugar? Insulin, right? So over a lifetime of producing tons of insulin to deal with the blood sugar, because you don't want too much sugar in the blood for too long, you become what? Insulin resistance, which then leads to diabetes. So I want you to keep that in the back of your mind as we go through this presentation. All right, so why do we care about breath? Why is this important? What is normal? All right, so most textbooks will say, and I certainly learned, 12 to 20 breaths per minute is considered normal. Some would argue 6 to 10 breaths is normal. It depends who you ask. I think a lot of research needs to be done on this. There's a lot of preliminary work on overbreathing, how most of us tend to overbreathe, and that causes all kinds of issues. So in the book Breath by James Nestor, he says 6 to 10 breaths is ideal. Now, when you extrapolate that out, if you are in the quote-unquote normal 12 to 20 breaths, that's 28,000 plus breaths per day. If you're doing more 6 to 10 breaths, we're looking at 8 to 9,000 breaths per day. Now, if you've got some faulty mechanics and you're doing 29,000 cycles of that a day, you can imagine how things can spiral out of control rather quickly. All right, breathing has a strong effect on our blood gases, our ABGs. You can quickly alter your pH. So I want to quickly review the pH scale. So it's a 0 to 14 scale. 7 is in the middle. 0 is, or the lower you go, the more acidic you become, and the higher you go, the more alkalinic. Now, when you have higher levels of oxygen in the blood, that makes you more alkaline. And as carbon dioxide builds up, as in conditions such as COPD or just holding your breath, you become more acidic. So when you're higher on the alkalinity scale, that's called respiratory alkalosis. And if you're lower, that's called respiratory acidosis. And here is the chemical equation for inspiration. So hopefully you guys recognize that first molecule from high school chemistry. C6H12O6 is glucose plus oxygen yields carbon dioxide, water, and energy. So I like that equation because it shows that how we take sugar and air and turn it into energy. And that's what breathing really is. It's the utilization of air and converting it into energy. Now, this shows how CO2 buildup turns into a more acidic state. So when CO2 rises, if you're doing a long breath hold, or you're a free diver or something like that, or you have COPD, carbon dioxide binds with the water in our blood. That turns into carbonic acid, which very quickly associates to bicarbonate and hydrogen ions. Hydrogen ions are acid. Now this equation goes the opposite way too. So bicarbonate is the buffer for hydrogen ions. A side note, there's also carnosine, which also can buffer the buildup of acid in our tissues, particularly at the muscle level. Now carnosine is made from beta-alanine and histidine. Beta-alanine tends to be the rate limiting part of that equation. So that's why taking beta-alanine as a supplement can help improve exercise tolerance, because it creates carnosine, which then buffers the acid that you feel when you work out. Up next, we have the Bohr effect. So this is a very important concept to understand. The need to breathe, a lot of people would assume it's the lack of oxygen. It's really the buildup of CO2 in the bloodstream. So we have chemoreceptors that can sense how much CO2 there is, and people have different sensitivities to CO2. But that is plastic. You can improve that. That's exactly what freedivers do. In fact, there is a Croatian freediver. His name is Budimir Sobat. I'm not sure if I'm pronouncing it right. Sorry about that. But he's able to hold his breath for over 24 minutes underwater, all from training the chemoreceptors for CO2. So what the Bohr effect is the more you can hold CO2 into your bloodstream, the more it sort of scrubs off or pushes the oxygen from the hemoglobin into your tissue, so it delivers more oxygen. So some would call this the oxygen advantage. All right, let's talk about temperature. We get these questions a lot as physical therapists. Should I heat it? Should I ice it? What should I do? I personally never ice my injuries, and here's part of why. So as temperature rises, more oxygen is delivered to tissues, and the converse is true for cold. So as temperature decreases, oxygen binds more readily to hemoglobin. So in a lot of painful situations our patients go through, we know there's tissue ischemia. So picture, like students that sit in front of a laptop all day. Those middle traps are put on the low load long-term stretch. The tissue becomes ischemic and you develop what we call trigger points. So in those scenarios, I want more oxygen to the area, not less. Just a little food for thought. All right. Assessment. So we have their breathing mechanics, their breathing pattern. Are they breathing through the nose? Are they breathing through the mouth? And we'll talk about the Bolt test and HRV. So we have our normal breath, which should look like belly rises on inhale, and then the chest rises. Right? So diaphragmatic breathing is what that's called. So air is supposed to come in through negative pressure, like a bellows, as the diaphragm descends, which pushes the abdominal contents up. And as you exhale, that all collapses down. And then we learn that patients with COPD, they develop a paradoxical breathing pattern where they lead with their chest, that bucket handle approach to breath. So they're basically breathing with all their secondary muscles, such as their scalenes, their pecs, anything but the diaphragm. And over time, the diaphragm gets weak and it's less efficient. So when I learned about this in school, I just thought, okay, that's only patients with COPD. But anybody who lays on my table in my clinic, one of the first things I do is watch how they breathe. And I will say 9 out of 10 people are breathing paradoxically, sort of chest first breathing. And why is this? Well, it turns out that the way you breathe is significantly tied to your nervous system, your autonomic nervous system. So belly breathing, diaphragmatic breathing, is highly associated with the parasympathetic division, whereas chest dominant breathing is highly associated with the sympathetic division. And this makes sense. Picture somebody in like a bar fight or something like that. Their chest is going to be heaving. And this can lead to all kinds of issues when done chronically. For example, if you're using those secondary like neck muscles, for example, to pull up on your rib cage constantly, you're going to develop some stiffness in the neck. So I hear a lot of my patients say, I hold my stress in my neck or my traps, right? Well, I always say, well, it's because you're breathing with your traps. And the same is true for nose versus the mouth. So the mouth is highly tied to the sympathetic division, whereas the nose is highly tied to the parasympathetic division. And something that's kind of interesting too with the nostrils is that one nostril is paired to the parasympathetic division, that's the left nostril, whereas the right nostril is paired with the sympathetic division. So you can kind of use this. If you're in a sympathetic state, like say you have to give a presentation, you're nervous, before the presentation, you can just take your thumb, cover your right nostril, and breathe through your left nostril for a few minutes. And that should theoretically trigger your parasympathetic division and help calm you down. In fact, there was this fascinating study about this woman with schizophrenia who was having constant hallucinations, and it turned out her right nostril was blocked. And just by giving her some right nostril breathing exercise, it was able to reduce her hallucinations. So let's move on to the Bolt test, something you can kind of quickly and easily do to assess someone's stress and their CO2 tolerance. So it's called the Bolt test. So what you have to do is take a normal breath in and out, do several rounds of that, just normal breathing. And then when you decide to start the test, do a normal exhale, not a max exhale, but a normal exhale. Take your fingers, plug your nose, and count, and see how long you can go for. You stop the test when you feel the first urge to breathe or you have some sort of symptom like your throat closing. If you have to take a large breath after the test, you've held your breath too long, you may need to repeat it. So if you want to test this before I go on to the next slide, go ahead and pause the video now. How did you do? So average tends to be about 20 seconds. 25 to 40 seconds is ideal. If you're under that, you're probably sensitive to CO2. This is kind of a snapshot too. It's finicky. It's kind of like heart rate or blood pressure. It depends on your state. So this is really like a good litmus test to see what type of stress state you are in. If you're poorly slept, for example, you're going to tend to do worse on this test. HRV is another great measure. You need a device to do it, such as the Morpheus or the Whoop strap or Oura ring. They measure heart rate variability. And what that really is a measure of recovery or a return to baseline. So the idea is, this is a kind of complicated topic. You can make a presentation on HRV alone. But HRV really means, if your heart is beating 60 beats per minute, it's not actually beating like on the second perfectly. There's variance, right? So as we inhale, our heart rate increases slightly, and as we exhale, it decreases slightly. So there's this bit of like a yin-yang, a sort of a plus minus that is normal. So it's a bit counterintuitive, but basically the higher the HRV, the better state you're in, and that is highly associated with your recovery. So for example, I use the Morpheus watch or strap. It's just a quick little 2-minute test you do in the morning. You run the test, and you just sit there and breathe normally while it runs, and it'll spit out a recovery score. And that number is both an assessment and a way to guide what you may do that day. So this is an equation I love. It's stress plus recovery equals adaptation. So adaptations, it's whatever you want to be. Is it stronger, faster, perform better? That's the goal, right? And how do you do this? You add a stimulus or stressor like exercise, and then you need to recover. So that usually boils down to sleep and some lifestyle things. But the recovery component is the one that everyone forgets about, and this is what HRV is really measuring. So if you had a heavy workout and your recovery score is, say, 60%, you're not fully recovered. So you either worked out too hard, or you didn't sleep well enough, or you stayed up too late on your phone or Netflixing, and that may guide your decision about what to do that day. If you have a 50% recovery score, maybe you don't want to set a PR in the gym that day. Maybe you want to do some light aerobic work. Conversely, if you worked out and you're 100% recovered, well, you may have had some awesome sleep, but maybe you didn't work out hard enough, right? So the ideal is if you've had a pretty good session and you slept well, about 85% recovery, something like that, that's kind of what you're shooting for, right? Because this is the goal. You've probably heard the analogy of the bucket or the glass. You want to become more resilient, you want to become better. So if you're pouring water into a small bucket, it will eventually overflow. And the answer is not just pour more water in, it's just going to continue to overflow and exceed your capacity. So the answer is to build a bigger bucket. But it can be problematic or difficult to build a bigger bucket if you've got holes in your bucket. So all the stressors or exercise in the world won't do you much good if you've got holes in the bucket. You first have to plug those holes as much as you can, and then you can apply the right stress, and then you get your bigger bucket. So what are the things that create the holes? It's all things we know we're not supposed to be doing, right? It's the number one by far is poor sleep or lack of sleep. That falls in line with some lifestyle choices, avoiding too much blue light at night and not getting enough sun during the day. Excess caffeine, chronic stress, caloric deficit. So I put that one there because it is a type of stressor. There's a lot of benefit to fasting, but I see a lot of guys my age that they're fasting all day and they're sprinting on the rower and working out and they're exhausted. It's too much. So you have to be strategic with using fasting. And then, of course, breathing mechanics is how this all ties together, right? So if you're chronically chest breathing, chronically sympathetic, that is a big stressor, especially when you're doing it 29,000 times a day. So dial those things in, work on breathing mechanics, prioritize sleep. A lot of people will get up at 4 o'clock in the morning and do their cardio. Well, Stan Efferding has this great quote. That's like stepping over $100 bills to pick up dimes. Next, let's get into types of breath. So I just picked 4 things to talk about. Sympathetic breath is what we'll do at the end of the presentation. I call it the breathing spin up. It's a great thing to do before workout. And that's basically the Wim Hof style of breathing. Parasympathetic breathing, that's more the belly breathing, right? That's a great way to wind down your day. I tell my patients to do that at the end of the day, especially if they're having trouble falling asleep. It really helps with recovery. Box breathing is a way to improve, one of many ways to improve your CO2 tolerance. So what that looks like a typical box breathing style would be 4-4-4-4. So that'd be a 4-second inhale, a 4-second breath hold, a 4-second exhale, and then a 4-second breath hold and repeat. So it's actually a little harder than it sounds, especially if you pair that with some light aerobic work. So if you just go for a walk and work on your box breathing, it's a really good way to build your CO2 tolerance. And as a reminder, as you build your CO2 tolerance, that means more oxygen is delivered to your tissues so you can exercise better and longer. Now, equal breathing is just interesting. It's just this is a concept that came out of James Nestor's book, Breath. There's this weird ratio that exists. If you take a 5.5 second inhale and a 5.5 second exhale, that equals almost perfectly 5.5 breaths per minute. And a lot of people and a lot of the yogis, they all fall upon this 5.5 style of breath as being ideal. Okay, let's turn the corner to the last part of the presentation. Clinical implications, so things that a physical therapist might want to know about with breath work and how you can apply this to your clinic. So breathing has a strong impact on the lymphatic system. So the lymphatic system is kind of like the neglected system, but that's really the system that handles swelling. And there is a collection tubule. The largest part of the lymphatic system is something called the cisterna chyli, and that sits underneath your diaphragm. So simply by doing diaphragmatic breathing, and it pumps that cisterna chyli and can help mitigate swelling. So I do this often with my patients. I'll have them lay on their back, elevate their legs, and I'll kind of do this sequential drainage. So I'll start off to have them doing ankle pumps to pump the calf, to push swelling up to the quads, where I have them do quad sets, hamstring sets, glute sets, and then I'll have them diaphragmatically breathe. And that can have a really profound effect on the amount of swelling they're dealing with, especially post-op. And, when someone comes into my office and they are acutely flared up, like let's say with back pain, I'll have them breathe. That's one of the first things I do. Now, this can have some significant impacts, and this goes a little bit into pain science. So basically, when they're acutely flared up, their nervous system has declared an issue and become hyper-vigilant to an area of the body, and it feels like it's under threat, so it kind of amplifies the pain signal. So any kind of movement in that situation usually will be really painful. So one of the things that's happening when you're breathing is your spine is gently flexing and extending, particularly the low back, and that's going to be pretty non-threatening to the nervous system. So if you can put some non-threatening input to your nervous system, it does not provoke pain, that slowly will calm the system down and turn down that amplification. Swelling, I already talked about. Parasympathetic tone, right? So if you think about what your muscle does in preparation for a fight or flight situation, it enhances the muscular tone, right? So if you trigger the parasympathetic breathing with diaphragmatic breathing, it has the opposite effect. It calms down the muscle tone. So we know there's a lot of pain associated with muscle stiffness. The QL muscle is, you'll find, commonly irritated in people with low back pain. It kind of acts to guard against movement oftentimes. But one of the things that happens when you're breathing, particularly with diaphragmatic breathing, you're getting an elevation and depression of the ribs. And the QL does attach to the rib cage, the bottom ribs. So when you're breathing and really doing intentional, deeper breathing, you're getting a sort of mechanical stretch on that QL muscle. And of course, tissue pH, we talked about that earlier. Tissue ischemia, we know, causes trigger points. Enhance the oxygenation to the tissues through breathing can really help reduce some muscle pain. Sleep apnea, I want to include this because it is a big deal and it sort of gets like joked around about. It's a big problem. I have it. I have severe sleep apnea, and my wife sort of urged me to see a pulmonologist and get a CPAP, and honestly, I don't know if I'd be standing here anymore had she not done that. Here's a list of all the things that sleep apnea can cause if left unchecked. And if you look at it, it's all kind of the same thing, really. So it's sympathetic breathing because you're breathing through your mouth all night, right? What does that do? It triggers cortisol release, which triggers sugar or glucose in the bloodstream. Years and years of that turns into insulin resistance, which then becomes diabetes, right? And then diabetes causes basically everything on that list. Insulin is a builder. Its main role is to push sugar out of the blood, but it also builds things. That's why you see those that have to inject insulin will develop a sort of a pocket of fat in that area, because insulin signals for cells to grow, and that's what it does. That's the association between diabetes and weight gain. It's also normally a vasodilator, so when you become insulin resistant, it has the opposite effect. It becomes a vasoconstrictor. That's the association between diabetes and heart attack or stroke. As you get too much sugar in the brain, that's what Alzheimer's is, right? So that's what they call Alzheimer's now, is type 3 diabetes. And it also leads to poor recovery, which is more the same thing. More sympathetic, not enough parasympathetic. And of course, there is sleep divorce. This is a term my pulmonologist told me about. I'm not sure if he coined it or if that's a real term, but basically that means when you wake up, your spouse is in another bedroom because the snoring is so bad. You don't want that. Now, here is a topic that I love, this idea of physiologic flexibility. This is a term I got from a course I took by the same name from Dr. Mike T. Nelson. And the premise is that we have 4 main regulators of the body, and we've talked a bunch about this already, and they all overlap with each other. So you've got the pH, the oxygen and CO2 tolerance, your body's temperature, and blood glucose. Those 4 regulators are super tightly controlled by the body. And here's the thing, is that if we go past those boundaries, bad things tend to happen, right? We're used to living in 74 to 77 degree climates. You go from your air-conditioned house to your air-conditioned car, air-conditioned gym, and so on and so forth. And then suddenly you have to go travel to a different climate to see some relatives, and you get sick. That means basically you've become physiologically inflexible. This is what happens as someone gets deconditioned. They can't tolerate CO2 buildup. They can't tolerate the hydrogen ions in their muscle tissue, and they're becoming more fragile. So the idea here is if you push one of these domains, you push the envelope a little bit through progressive overload training, you can build your physiologic flexibility. But the cool thing is if you build it in one of the domains, you can build it in all of the domains. So there's carryover effect. So as we talked about earlier, the more you can tolerate CO2 in your blood, the more you can tolerate acid in your blood because you're becoming more acidic. Well, exercise also creates acid buildup. So just by working on breath holds, you can improve your endurance. Now, cold plunging and saunas are all the rage right now, and for good reason. People are finding they're dropping their blood glucose. And I saw this personally. All you have to do is wear a glucose monitor and jump in a sauna or a cold plunge, and you'll see consistently that your blood sugar drops every time. So this means that we can manage diabetes better with cold exposure and heat exposure. So to wrap this all up, I think life is really about balance. I think of the yin-yang as kind of like the sympathetic and parasympathetic nervous system. We don't want to be all in one all the time. We don't want to avoid stress at all costs. That makes us fragile, right? We also don't want to be in a sympathetic state all the time, chronically under stress. That breaks us down as well. We want the right amount of balance plus some graded exposure, and that makes us a little more robust and physiologically flexible. Finally, I think all physical therapists need to expose themselves to these books and this type of education. So Breath, I've mentioned that book several times in this presentation. That is one of my favorite books. I've read it several times. I also think all physical therapists need to just Google or go to YouTube and check out Lorimer Moseley, go down the rabbit hole with him, watch all his videos. He's a physio out of Australia. He's a pain science researcher. He gives fantastic presentations. He's hilarious. but he does a really good job at tying how pain relates to the nervous system. Why We Get Sick is a book by Benjamin Bickman. He paints the picture that insulin resistance really underpins just about every problem that we deal with in Western society. And finally, the course I just mentioned earlier, by far my favorite Con Ed course I've ever taken, Physiologic Flexibility by Mike T. Nelson. Okay, and that wraps it up. So if you have questions, email me at info@dynamicnaples.com. Thank you.